8,800, the number of employed physicians in the state of North Carolina who will likely quit, retire, or move outside of the practice of medicine within the next 2 years. Why the mass exodus, and what can we do to prevent it? The focus of my leadership project was to answer those questions. The COVID-19 pandemic is said to be one of the factors that's leading to that number of physicians resigning from practice. But many people believe that it's the rise in the corporate practice of medicine that's also contributing to this number. For the last several decades, there's been a gradual trend in physicians moving from independent practice or physician-owned practices to being employed by hospitals or healthcare entities. In the last 3 years, there's been a dramatic increase in the number of employed physicians. And now the US physician workforce is thought to be comprised of 70% of employed physicians. As the number of employed physicians has increased, the number of reported burnout has also increased, with burnout rates last year being the highest ever reported. A recent article by the AMA showed of the physicians they surveyed, 20% will be leaving the medical practice, their current medical practice, within the next 2 years, and 33% will be reducing their current work hours within the next 12 months. There are 44,000 licensed physicians today in the state of North Carolina. That means 8,800 are thinking of leaving practice within the next 2 years. While the corporate practice of medicine is thought to be contributing to this increased resignation number and turnover number, burnout for certain is also increasing and driving that factor. And while burnout contributes to the degree of resignations, burnout is also a public safety concern. So much so that the FSMB, which is the national entity that oversees the individual state medical boards, in 2016 felt that it was such a public safety concern that it created a physician wellness and burnout work group to identify resources and study strategies for prevention. Similarly, the North Carolina Medical Board, through its outreach committee, has also established a physician wellness and burnout work group, understanding the impact burnout has on quality of care and patient complaints. And I think most importantly, burnout is contributing to an increasing rate of physician-reported suicide. There was a recent Medscape article which suggested that last year, 10% of physicians either contemplated or attempted suicide. So we've talked about physician turnover and the impact burnout has on that factor. We've talked about quality of care concerns and medical errors, but burnout is also extremely costly financially to our current healthcare systems. So the goal of my project was to create a resource that employed physicians could utilize to help evaluate their employment opportunities prior to signing a contract or taking on that job offer, and also be used to evaluate their current work environment. As I went through my project and met with various individuals and entities, you begin to realize that employed physicians work in an environment full of pitfalls and perils. They have different motivations and loyalties to their employers, who may have different motivations outside of the physician, and understanding the mismatch that can occur between the employer needs and the employee needs is important. So throughout the length of my project, I did 3 separate things. One, I availed myself to the North Carolina Medical Board's Outreach Committee's work group on physician wellness and burnout. I participated in the North Carolina Medical Board's Policy Committee, which was working on coming up with a position statement that employed physicians could utilize. And I also joined my own organization's Novant Health's medical group, Physician and Advanced Practice Providers Engagement Council, which was focused on looking at burnout within our own institution. The Outreach Committee and the Policy Committee met biannually during the length of the project, and Novant's Engagement Council met monthly. So one of the results of the project was that the Policy Committee of the North Carolina Medical Board did come up with a proposed position statement for employed licensees. And this position statement is currently posted on the North Carolina Medical Board's website, and the website's on the bottom of the slide. It's a proposal in its current form, and it has to be on the website for a certain number of days to receive public comments. So I encourage you to go on the website and review it, and as you review it, analyze, will it change if you are an employed physician? Will it change whether or not you sign or negotiate your renewal contract for the next year? Will it change whether or not you sign with potentially a current employer? And I won't go through and read the position statement. I pulled out a few that I thought were important. I will highlight one, which is employment agreements are legal documents. And that seems like a very simple statement that we all understand that an employment agreement is a legal document. But I'll say personally, as a physician coming out of medical school and residency training, I never received any education on negotiating a contract. I never received any education on employment law. Yet my first job, I signed my employment agreement after reading it and going, yeah, that sounds about right, and signed on the dotted line. We should recognize that there are experts in the field of medical employment law, and we should rely on these experts. And anybody who's going to sign an employment agreement should seek legal counsel or some of these other experts in the field to review it and ensure that it's something that lines up with your personal values. They can review the contract and let you know whether or not this seems like an environment that's going to align with the culture and the mission that you want to practice. Is it going to be a contract focused on productivity? Is it going to be a contract that focuses on the quality of care that's being administered? The position statement also goes and addresses other clauses that we're routinely seeing in employment contracts across our state, which include our opinion on non-compete clauses and the ability to terminate without cause. As a part of the Novant Medical Group's Engagement Council, we were able to review MGMA data that demonstrated when you asked physicians versus when you asked hospital administrators what they thought contributed to burnout, there was a clear dichotomy in the perceptions. 62% of physicians believe that employees or their employer contributes to burnout, whereas only 14% of administration feels like the employer contributes to burnout. Given that dramatic difference in perception, I think that's an indication that there's learning and understanding that can occur between both parties in trying to determine why that is. It made me think of this cartoon that I had seen previously, where you have the man and the woman, and the man is trying to help the woman get up the cliff. And the man is thinking to himself, why isn't she working harder and climbing harder to get up here? Can't she see how much pain I'm in holding her here with this boulder on my back, unaware that there's a snake that he can't see, that if she climbs any higher is going to attack her. And the woman is thinking, well, why can't he just pull me up quickly, not realizing and being able to see the pain he's in from the boulder that's on his back. So I think if we communicate more, if physicians and administration in these employed situations are able to communicate more and understand better where the other is coming from, maybe we can start addressing this burnout issue. And so as I went through my project and I recognized across the state all the work that's going into the effort of physician burnout, preventing, increasing physician wellness, I realized that the individual healthcare entities are working on this. Duke, UNC, Wake Forest, they all have wellness initiatives and programs. The major healthcare entities such as Novant have engagement councils. Stakeholders are engaged, the medical board, even the North Carolina Medical Society is studying this issue. But we're all working hard in our individual silos. And we need to come together, come out of our silos, and start working together as a team to address this problem. It's a huge problem. The consortium, which the Medical Society started back, I think, in 2016, has just recently reconvened in an effort to get multiple stakeholders together targeting this issue. 8,800 physicians leaving the North Carolina medical workforce should motivate anybody. But if the 8,800 doesn't get you, the 4,400 reported North Carolina physicians that have contemplated or attempted suicide in the last year should. I see it as a public health crisis. Thank you, and I'm happy to take any questions.